Hello, everyone, and welcome to our question lab. We're happy to have you here this evening as we discuss and dissect 4 questions on the topic of respiratory physiology. Leading our dissection in our question lab once again today is Dr. Paris Vakaria, and he's going to introduce himself now. Paris.
Thank you, Sean. Hey guys, my name is Paris. I am a dermatology resident here at UT Southwestern in Dallas, Texas. Originally graduated from pharmacy school in Missouri and then went back home to Michigan to do medical school. I also am an RX coach with USMLE-Rx, so that means I work one-on-one with students such as yourselves to help prepare you guys for USMLE Step 1, Step 2 CK as well, and I'm happy to help lead tonight's session.
What I want you to know for now is that we will be using a similar methodology as we do with our RX coach program and our coaching students throughout the course of the evening. So without any further ado, let's go ahead and get into our first question on respiratory physiology. As you can see, the answer choices have been removed. That is by design. We do that so that the answer choices do not guide or dictate your thought process, and also so that you do not see an answer choice that you are unfamiliar with, which may cause you to panic as you're trying to answer the question. After we've covered those up and removed them, we then move on and read the lead-in, which is the last sentence of the question itself. And we do that because we want you to know what the test writer is asking prior to reading that vignette. And that should save you time and help you point out all those relevant clues so you can save time and prevent yourself from having to reread the vignette on test day. So let's go ahead and read that vignette now. Which set of arterial blood gas values presented in the table is most likely in this patient? Which set of arterial blood gas values presented in this table is most likely in this patient? After we read the lead-in, we like to ask our students how many steps we believe this question will require. An example of a one-step question could be where you're asked for the diagnosis. An example of a two-step question could be where you're asked for the treatment of a diagnosis. And an example of a three-step question could be where you're asked for the mechanism of action for a treatment for a diagnosis. So with those examples in mind, please let us know in the question box how many steps you believe this question will require, and then we'll go ahead and move on to that vignette. Excellent. I see the responses coming in, so let's go ahead and read that vignette. A 55-year-old woman comes to the clinic because of 24 hours of palpitations, shortness of breath, and chest pain on inspiration. 5 days ago, she underwent mastectomy of the right breast due to ductal adenocarcinoma. Pulse is 112 per minute. Respirations are 33 per minute. Blood pressure is 110/77, and oxygen saturation is 90% on room air. An ECG shows sinus tachycardia. An X-ray of the chest is normal. Which set of arterial blood gas values presented in the table is most likely in this patient? We would like all of you to start thinking about the relevant clues in the vignette and lead-in as I hand it off to Paris.
Thank you, Sean. So we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. And so starting off, generally the first thing you're going to get are demographics. In this case, we know we were told this is a 55-year-old woman. Always important to make note of that because that's going to really clue you in as to what's going on with the patient in terms of, what conditions should you be thinking of, okay? So always important to make note of that. Then generally they're going to tell you, what are they presenting with? In this case, they're presenting to the clinic because of palpitations and shortness of breath and chest pain on inspiration. So you do want to make note of those presenting signs and symptoms. And then a lot of times, like in this question, they'll tell you about the duration. And in this case, we know it's 24 hours, okay? As you can see here immediately, usually they like to give you some social history or some additional information relevant to that history of present illness, or HPI as we call it. Okay, so important information in this patient. And then also you can see some vital signs that are abnormal, and then some other additional investigations that were done. So you definitely want to make note of that because that's really going to help us come to a diagnosis here. So now let's looking at this lead-in. It's asking us about arterial blood gas values that's most likely in this patient, okay? So I think we've got a couple steps here. So I think one, we've got to figure out maybe what's going on in this patient, what's the condition, what's the issue here, and then two, based off that, what would be the suspected or likely are ABG values that we would see in that condition in that patient. So I think we've got a couple steps here. So let's go ahead and take a look at those answer choices. In this case, let's go ahead and take a look at that table. Okay. So we've got 5 answer choices here. Okay. So when we go through answer choices, what we recommend is that you start at the bottom and that you work your way up to the top. And the reason we recommend this is because, a lot of times we'll see students who they'll start at the top, they'll see something they like, and then they'll go ahead and select something without having gone through all the choices, and then sometimes they'll get that question wrong. So we recommend starting at the bottom, working your way up to the top to prevent yourself from doing this and to prevent yourself from biasing yourself, okay? So I'll go ahead and do that now. So our 4 columns are, we have pH, we have partial pressure of CO2 or carbon dioxide, we have partial pressure of oxygen or PO2, and we have serum bicarbonate. So answer choice E, a pH of 7.56, PCO2 of 25, PO2 of 65, and a bicarbonate of 22. Answer choice D, a pH of 7.47, PCO2 of 52, PO2 of 77, and a bicarb of 38. C, a pH of 7.44, PCO2 of 25, PO2 of 97, and a bicarb of 16. B, a pH of 7.33, a PCO2 of 66, a PO2 of 65, and a bicarb of 34. And lastly, answer choice A, 7.2 is the pH, PCO2 of 35, PO2 of 80, and a bicarb of 14. So we're going to go ahead and open up that answer choice, the answer choices as a poll. Go ahead and select the one that you think is the best answer, and we will talk about it in just a few seconds.
So as you can see here, I made a little bit of a mistake. Answer choice D is actually D, so I have C on there twice, so please make note of that. I hope you caught my mistake already. We'll give all of you a few moments here to select the best answer choice, and then as always, we'll go over the correct and incorrect answer choices. I see the responses coming in. There seems to be a clear favorite already. Remember that on test day, there is no penalty for guessing, so make sure you never leave a question blank. And this evening, if you have any doubts, take your best guess, and we'll review it together when we're done. All right. Well, let's take a look and see what the audience selected. Looks like in first place, we had answer choice E, with 31% of you selecting E, 21% of you selected C, and in close place, we had B and D. So let's take a look and see what the correct answer is. And the correct answer is E, and 31% of you got it right. Great job. This was a challenging question. Let me hand it off to Paris so he can explain it to us. Paris.
Thank you, Sean. So great job, guys. This is a tough question, but let's take a look at what's going on. So hopefully you guys were able to pick up on that clue that this patient just had breast surgery, okay, breast cancer surgery. Now she's hypoxemic, she's tachycardic, she's tachypnic, she's got shortness of breath, and she also has pleuritic chest pain on inspiration. So a lot of things here that should be pointing towards a venous thromboembolism or blood clot, or specifically in this case, a pulmonary embolism, okay? She has a few risk factors for that. 1, she has a malignancy, and 2, she just underwent surgery and is in a postoperative state. So individuals with acute PE, like this patient, are often tachypnic, okay? And they have hypoxemia. So if they're breathing a lot, if they're expiring a lot, we would expect this patient to have acute respiratory alkalosis, okay? And in that setting, that would fit best with answer choice E, okay? So the pH in answer choice E is alkalotic, you would be kind of blowing off or ventilating off CO2 because you're tachypnic. So your PCO2 should be lower than normal. And we also already know that this patient is hypoxemic because of that PE. Now the bicarb will slowly over time start to decrease to try to help compensate, okay? So you can see already the serum bicarbonate, it's low, but it's, it's normal, but it's kind of on the lower end of normal, 22. So it's working its way down to try to help compensate for that respiratory alkalosis, okay? So let's go ahead and take a look at the next slide. Sean has gone ahead and pulled up a table on PE, okay? So we can see there in this patient that pulmonary emboli may present with sudden onset dyspnea, shortness of breath, essentially, pleuritic chest pain, elevated respiratory rate, elevated heart rate, and hypoxemia. So like this patient, also sudden onset. This all happened within 24 hours. And then because of that, they can then develop acute respiratory alkalosis, like our patient, okay? If we take a look at the next slide as well, this is kind of going back to acid-base physiology. You can see there in respiratory alkalosis at the bottom that the pH will be elevated and the PCO2 will decrease. You're breathing that out. Your body will then eventually work to compensate that, as you can see with the red downward arrow, by decreasing the serum bicarbonate. Okay, so over time, that will decrease. So if we go back to our vignette and our tables, you can see there, hopefully, how answer choice E fits as we talked about. Let's talk about the other answer choices in case you had selected those. So answer choice D, an elevated pH, this is also suggesting alkalosis. However, this is in the setting of an elevated serum bicarbonate. So this would suggest metabolic alkalosis, so a patient who is vomiting or taking diuretics. Answer choice C, this is a patient with a normal pH, okay? However, the PCO2 is very low and the serum bicarbonate is also low. So this would be the setting of chronic respiratory alkalosis. So you can see there also a low PCO2, and you can see there that the bicarb has eventually made its way downward to compensate for respiratory alkalosis. So this would be someone who's living at a high altitude for a long period of time. So that's more of a chronic picture, while answer choice CE is an acute picture, like our patient. Answer choice B, this low pH suggests an acidosis, and you can see there that the elevated PCO2 suggests it is of a respiratory origin, okay? So someone who has chronic hypoventilation, like COPD, for example. Lastly, answer choice A, this also is an acidotic picture, but as you can see there from the low bicarb, this suggests a metabolic acidosis. So a whole variety of etiologies there, depending on if there's an elevated anion gap or not. And so that would be a few other risk factors, not what we're being told in this patient. So hopefully this was a good walkthrough of acid-base physiology.
Excellent. Thank you, Parles. Definitely a high yield topic, something you'll be tested on, but also important for practice. So we hope you paid attention. Let's move on now to our second question of the evening. Once again, the answer choices are covered up. That is by design, and we will begin with the lead-in. Which of the following stimuli is most likely controlling this patient's drive to breathe? Which of the following stimuli is most likely controlling this patient's drive to breathe? We'll give all of you a few moments here to respond in the question box and let us know how many steps you believe this question will require. Then we'll move on to the vignette. All right, I see some responses coming in, so let's go ahead and read that vignette. A 65-year-old man with chronic obstructive pulmonary disease comes to the physician because of a 2-day history of coughing and worsening shortness of breath. He was diagnosed with chronic obstructive pulmonary disease 10 years ago and has had multiple episodes in the past with similar symptoms. Temperature is 37.7 Celsius or 99.8 Fahrenheit. and respirations are 33 per minute. Physical examination reveals that he must lean forward and support himself with his arms to breathe. Retractions can be seen with each breath, and expiratory wheezes are heard. Which of the following stimuli is likely controlling this patient's drive to breathe? Once again, we want you to start thinking about the important clues in the vignette and lead-in as I hand it off to Paras.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. And so now we have a 65-year-old male. So a little bit of a different demographic here, but still an elderly patient. And we know he's got COPD. Generally, they then tell you why he's coming in. And in this case, we're told because of coughing and worsening shortness of breath. They also gave us a duration, 2 days. So important to make note of that. As you could tell in the last question, knowing that it was an acute issue definitely helped figure out that the correct answer in that question. So we know how long he's had this disease. We are given some additional information about his vital signs. And then they give us some important pulmonary exam findings. And we can tell this is a pulmonary question, okay? So definitely want to make note of that. Use those clues to figure out what's going on in this patient, okay? So then we get to the lead-in, and it's asking about the stimuli that's most likely controlling the patient's drive to breathe, okay? So kind of a uniquely worded question, so it's important to, always take a second look at that. Stimuli most likely controlling the patient's drive to breathe. So I think we've got a couple steps here at least. I think one, we've got to figure out maybe what's going on in this patient, what's the condition, what's the issue. And then two, in that scenario, what would be causing or controlling the patient's respiratory drive or drive to breathe? Okay, so I think in that setting, in that condition, so I think one, we need to figure out what's going on. Two, in that setting, what would control the patient's drive to breathe? So let's go ahead and take a look at the answer choices in this question. And in this question, you see we have 5 answer choices. We've got answer choice A all the way to E, and once again, I'm going to start at the bottom and I'm going to work my way up to the top. Answer choice E, low arterial partial pressure of oxygen. D, low arterial pH. C, low alveolar partial pressure of oxygen. B, high arterial partial pressure of carbon dioxide. And A, high alveolar partial pressure of carbon dioxide. So make sure you're reading those answer choices closely. We're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
All right, thank you, Paras. Once again, the poll is open. We're going to wait until about 2/3 of you have responded before moving on. Keep in mind that, as always, we do have a raffle and a special offer. So make sure you stick around until the end because you must be present to win. I see the responses coming in. We'll give all of you a few more moments here. All right. It's a tough question, so we'll give you some more time here. All right. Let's take a look and see what all of you selected. Looks like there was a clear favorite, and that was answer choice E, a low arterial partial pressure of oxygen. And in second place, with half as many votes, was B. So let's take a look and see what the correct answer is. And the correct answer is indeed E, and 44% of you got it right. So great job. Let me hand it off to Paras.
Thank you, Sean. So yes, nice job with this question as well. Another tough question. So let's take a look at what's going on. So we know that this patient has COPD, and it's likely he's likely having a COPD exacerbation. Okay, they told us about multiple episodes like this in the past. Okay, he has increased cough, increased shortness of breath. Okay, and he likely, as we know, he is tachypnic. Okay, And that increased respiratory rate is likely driven by the low arterial partial pressure of oxygen, okay? Now, in most patients, if you have a high partial pressure of CO2 or carbon dioxide, that would be the main driving factor for respiration. So in your normal healthy patient, if you are having a buildup of carbon dioxide, that would be a drive for you to start breathing more. And that makes sense. You want to breathe that out. However, certain patients have chronic hypercapnia, such as in patients with COPD. So their baseline rate or their baseline level of CO2 is chronically a little bit elevated because they're not able to breathe out as great as other patients. So in these patients, the respiratory drive and the stimuli of carbon dioxide kind of gets blunted over time. And instead, the respiratory drive is controlled by oxygen. So in cases where these patients then get a low oxygen level, then they start to get tachypnic, okay? So in these patients, the respiratory drive is the low arterial partial pressure of oxygen, okay? If you selected some of the other answer choices, like answer choice D, this would be getting at low arterial pH or acidosis. So this can also control respiratory drive, but not as much as having low oxygen. That would be the main stimuli here. Answer choice C, alveolar oxygen pressures do not influence the respiratory drive, both for O2 or CO2. So both answer choice C and A are incorrect. It's not the alveolar pressures that would stimulate drive, it's the arterial pressures. Answer choice B, this would be a correct answer in normal healthy patients. However, in these patients with chronic hypercapnia, this is less likely to be controlling the patient's drive to breathe. So hopefully you guys understood that concept of chronic hypercapnia and patients with COPD and what drives them to be tachypnic in these situations. And great job on this question as well.
Excellent, thank you, Parles. Yeah, great job. 44% of you got it right, and it was a challenging question. I want to talk to you briefly about RX Coach before we move on. So RX Coach is our coaching and tutoring program. We work one-on-one with students just like you. So whether you're at the beginning stages of your medical education or you're graduating, whether you're studying for block exams, comp exams, shelf exams, USMLE or COMLEX, step 1 or step 2, we're here to help you. We can either take your syllabus and make you a personalized study plan based on that, or if you're studying for a comprehensive exam or for a USMLE or COMLEX exam, we'll administer one of our own assessments and then use that as a baseline to create that personalized study plan. Then we'll work with you at regular intervals to help you implement that study plan, identify your knowledge gaps, bridge those knowledge gaps, do practice questions with you, and really make sure that you're ready for the test. And as you know, we have a coach with us today that used to be a coaching student and is now one of our RX coaches. That's a great testament to the wonderful work our team does. All of our tutors are highly trained, they're all certified, and with all of our packages, you do get access to all of our resources. What sets us apart is that we've been in medical education for about 3 decades. We're one of the only companies that was in medical education prior to starting tutoring, which means we have a lot of data to back up our methodology. We've also authored our own resources. For example, our assessment or RX bricks, our question bank, our express videos, our flash facts. So you really do get the best of the best. If you're interested, you want that extra support, you want that guidance, you want that help, visit us at rx-coach.com, set up that free consultation to talk about the program and how it can benefit you. All right, once again, that's rx-coach.com. We're happy to help you in any way we can. Students oftentimes come to us and tell us that as a result of using our services, their studying became more efficient and they were able to achieve the goal they wanted in a shorter period of time. All right, so once again, that website is rx-coach.com. With that being said, let's move on to our third question of the evening on respiratory physiology. Once again, the answer choices are covered up. That is by design, and we will begin with the lead-in. Which of the following is the most likely complication of this patient's condition? Which of the following is the most likely complication of this patient's condition? I'll give all of you a few moments here to respond in the question box and let us know how many steps you believe this question will require. And then we'll move on to the vignette. All right, I see the responses coming in. So let's go ahead and take a look at that vignette. A 44-year-old man comes to his primary care physician because of fatigue and shortness of breath with exertion that have worsened gradually during the past year. He was diagnosed with obstructive sleep apnea last year. He does not smoke. He is 182.88 centimeters tall, or 6 feet, and weighs 150.59 kilograms, or 332 pounds. And his body mass index is 45 kilograms. There are no abnormalities on cardiorespiratory examination. Arterial blood gas shows PaO2 of 65, PaCO2 of 57, serum bicarb of 30, and X-ray of the chest is normal. Which of the following is the most likely complication of this patient's condition? Paras.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. And again, this is a 44-year-old male, so another important demographic here, okay? They then tell us that he's coming in because of fatigue and shortness of breath with exertion. They also give us a little bit of a different time frame now, so it's gradually worsening over the past year, so less acute. We do know that he has some medical history of obstructive sleep apnea. We're given some important physical exam and vital signs there. And then they give us an ABG, or arterial blood class. So you definitely, arterial blood gas. So you definitely want to interpret that. Definitely important to go through each of those values, use it, piece it together to help come up with an answer as to what's going on with this patient. So we then get to the lead-in of the most likely complication of this patient's condition. So I think we've got a couple steps here. I think one, we've got to figure out the patient's condition. Then two, what would be a complication in that patient, most likely complication. So whenever they say that, most likely complication, you also want to include that when you're highlighting and make note of that, because they could present a few different complications, and they could all, or some of them could be complications, but you want to pick the one that's most likely in this scenario, okay? So we're going to go ahead and open up those answer choices, and I will take a look, and we'll start at the bottom and we'll work our way up to the top. Answer choice E, left atrial dilation. D, jugular venous distension. C, intrapulmonary shunting. B, destruction of alveoli. And A, decreased diffusion capacity for carbon monoxide. So we're going to go ahead and open up the poll. Go ahead and select the answer choice you think is the best answer, and we'll talk about it in just a few seconds.
Excellent, thank you, Paras. The poll is open. Once again, we're going to wait until about 2/3 of you have responded. And then we'll hand it off to Paras for an explanation before we move on to our last question of the evening, and of course, our raffle and special offer. This is a tough question, so we'll give all of you a few extra seconds here. If this is your first time attending, please let us know in the question box. We'd love to hear from you. All right, I see the responses coming in. A few more moments here. Looks like we've got a tie so far between first and second place. All right, let's take a look and see what you selected. And it looks like it was pretty close. 30% of you selected C, intrapulmonary shunting, and 26% of you selected JVD, or jugular venous distension. Let's take a look and see what the correct answer is. And the correct answer is D, jugular venous distension, and 26% of you got it right. A challenging question indeed, but don't worry. Listen to Paris, we'll get it right on test day. Paris.
Thank you, Sean. Yes, definitely a tough question. So let's take a look at what's going on in this patient. We know he has obstructive sleep apnea. That's what he was diagnosed with last year, okay? Now, if we take a look, his BMI is pretty high. It's 45, okay? So he's got a BMI much greater than 30. He's got a CO2 much greater than 45, so we know that's elevated. And we also know that he doesn't really have any other reasons to have issues with respiration. Doesn't smoke. His cardiorespiratory exam is normal, so probably doesn't have COPD or asthma. So why is he so hypercapnic? Well, he probably has what's called obesity hypoventilation syndrome. So let's take a look at the next slide. Sean has gone ahead and pulled up a table on first aid about this, obesity hypoventilation syndrome. Used to be called Pickwickian syndrome, but we now refer to it as OHS. So patients who are obese, they're in a state of hypoventilation because of their obesity. So their CO2 is retained in their body during their waking hours. It's retained, okay? During sleep, it's also retained, and they also develop low oxygen. Okay. The best way to treat this is with weight loss and then also with positive airway pressure at night. Okay. So in this patient, if we go back to the question, he likely has obesity hypoventilation syndrome. Okay. So patients with obesity hyperventilation syndrome, they commonly develop pulmonary hypertension over time. And that can cause right heart failure over time. As you can then imagine, right heart failure would then lead to potentially positive JVD or jugular venous distension, okay? So in this patient, the complication is pulmonary hypertension, which can lead to jugular venous distension upstream of that. So let's take a look at the other answer choices in case you had selected that. Maybe what would have better fit with those. Answer choice E, that would be more so mitral stenosis or left-sided heart failure. So a little bit outside of the pulmonary circulation. Answer choice C, intrapulmonary shunting. This occurs secondary to a few things. So pneumonia, arteriovenous malformations, cardiac shunts. Based on the laboratory findings and the physical exam findings, probably not what's going on here. We know this patient is hypoxemic and hypercapnic. Destruction of alveoli, answer choice B. This would be something you would see in COPD, specifically emphysema. Okay, but we know here that the chest X-ray is normal and the cardiorespiratory exam is normal as well. Lastly, answer choice A, decreased DLCO. This would also be present in some things such as interstitial lung disease, okay? Well, again, we know based on that cardiorespiratory exam and chest X-ray that those are less likely. So the best answer choice here is D. Definitely a tough question, but hopefully a good learning case for you guys.
Excellent, thank you, Paris. Let's go ahead and move on now to our last question of the evening. We do have our raffle and special offer after, so make sure you stick around. Next week's topic, for those of you who are interested, is communications. Here we go with the lead-in. Which of the following changes is most likely to occur in this cyclist 1 week after arriving at this high altitude? Which of the following changes is most likely to occur in this cyclist 1 week after arriving at this high altitude? I'll give all of you a few moments here to respond in the question box and let us know how many steps you think this question will require. Then we'll move on to the lead-in. All right, I see the responses coming in, so let's go ahead and take a look at that vignette. A 26-year-old professional cyclist wants to maximize his performance by enhancing his condition. He decides to move to Leadville, Colorado, elevation 10,000 feet, and trains there for 3 months. Which of the following changes is most likely to occur in this cyclist 1 week after arriving at this high altitude? Paris.
Thank you, Sean. So a shorter question here. So once again, we will show you what we think are the important clues in this lead-in and the vignette. And we've done this a few times today, so hopefully you guys are starting to get a sense of what's important. And as we go through those answer choices and explanations, hopefully you guys see just why those clues are important. And then, when you go back and you need to look at the question again, you've really only highlighted what needs to be highlighted so you can save time and not have highlighted the less important stuff. So let's go ahead and take a look at this vignette. We've got a 26-year-old cyclist, and we're essentially told that he moves to Colorado and wants to train there for 3 months. Whenever you're given a question like that, and you can see there, always think of high altitude, okay? So then they're asking about a change that's most likely to occur 1 week after arriving at this high altitude. So I think this is a little bit tougher to determine steps, but I think I think we kind of need to know what is normal in a patient or in a person or a cyclist. So maybe what is normal, and then 2, what would happen when arriving to high altitude after 1 week. So that's important to make note of as well. They could change this question and say what would happen within 24 to 48 hours of arriving, or what could happen 1 year after arriving, okay? So it is important to keep note of that time frame, and that's why we highlighted it there. So let's go ahead and take a look at these answer choices and see what we're working with. Answer choice E, leftward shift of the hemoglobin dissociation curve. D, increased relaxed hemoglobin. C, increased oxyhemoglobin. B, increased T hemoglobin. And A, decreased 2,3 bisphosphoglycerate levels. So we're going to go ahead and open up that poll. Go ahead and select the answer you think is the best answer. We'll talk about it in just a few seconds.
Excellent. Thank you, Paras. This is our last question of the evening. Let's try to finish strong. And then, of course, we do have our raffle and special offer. Next week's topic is communications. I see the responses coming in. Looks like a pretty even split so far. Give all of you a few more moments here. Once again, if this is your first time attending, please let us know in the question box. We'd love to hear from you. All right, just a couple more seconds here. All right, well, let's take a look and see what all of you selected. And it looks like in first place here with 32% was answer choice E, leftward shift of the hemoglobin dissociation curve. And in second place, we had increased oxyhemoglobin. So let's take a look and see what the correct answer is. And the correct answer is B, increased T hemoglobin. So a tough question indeed. 15% of you got it right, but that's okay. Listen to Paras, you'll all get it right on test day. Paras.
Thank you, Sean. Yes, definitely a tough question. So let's take a look at what's going on. So as you can imagine, this patient is moving to a high altitude. So the immediate response would be hyperventilation. And he would be hyperventilating in response to the low inspired oxygen in the atmosphere, okay? So that would cause the increased hyperventilation, would cause an increased pH and respiratory alkalosis, okay? At first, this would cause a left shift in the oxygen hemoglobin dissociation curve. So let's go ahead and move on to the next slide, and we have that curve there. So you can see a leftward shift there would first emerge as it releases, releasing less oxygen to the tissues. Now, over the next few days, there is an increase in synthesis of 2,3-bisphosphoglycerate, okay? Now, that increase in 2,3-bisphosphoglycerate stabilizes what's called deoxyhemoglobin or taut hemoglobin or T hemoglobin, okay? And it does so at the expense of the R form of hemoglobin. So let's go ahead and let's move to the next slide real quick. And you can see here the hemoglobin molecules, okay? So you can see here oxygenated hemoglobin versus deoxygenated hemoglobin, okay? Now, the increased synthesis of 2,3-bisphosphoglycerate stabilizes deoxy or T hemoglobin, okay? This allows for more efficient offloading of oxygen at the tissue level. So you can see there in the right column of that table at the bottom right, an increase in 2,3-bisphosphoglycerate leads to increased oxygen unloading to tissues, okay? So this, then you would have a rightward shift of the oxygen hemoglobin dissociation curve. And you can see there eventually with high altitude, you get a rightward shift, okay? So that is why the deoxyhemoglobin or T form of hemoglobin is increased. That's stabilized, that's preferred. So let's take a look. The other answer choices, we'll kind of stay on this slide just so you guys can have this slide here as we compare the left and rightward shift. Answer choice E was a leftward shift of the hemoglobin dissociation curve. It actually, with time, with chronic hypoxemia, it's actually a rightward shift, as you can see there in that right column, so that's incorrect. Answer choice D, increased relaxed hemoglobin. Relaxed hemoglobin is the same as oxygenated or oxyhemoglobin, and as we talked about, this is actually the opposite. It's the deoxy form that is stabilized in this patient. Answer choice C, increased oxyhemoglobin. That's the same thing as relaxed hemoglobin, also incorrect. And then lastly, answer choice A, decreased 2,3-bisphosphoglycerate. As you can see there in that table on the right, you actually, with time and at high altitude, would have an increase in 2,3-BPG. So also incorrect in this question. So we'll go back to our vignette and our question so you guys can take a look one more time at those answer choices. The key thing here is knowing that T hemoglobin is the same as deoxyhemoglobin and that oxyhemoglobin is the same as relaxed hemoglobin. And so definitely a tough question here. Some nice respiratory physiology questions that we went over today, and great job on all these questions, and I will hand it back to you, Sean.